Call to order. The COVID-19 pandemic precludes us from meeting safely in the council chamber. We must therefore operate in this virtual fashion. We are utilizing guidelines provided to us by the Louisiana Attorney General. And just as a refresher, at the beginning of the meeting, council staff will read the agenda for today's meeting in its entirety. The agenda is also online at council.nola.gov. Anyone wishing to comment on an agenda item should go to council.nola.gov and fill out a public opinion form. Only written public comments are accepted. Public comment will be limited to one comment per person. Comments should be limited to 2 minutes and be germane to the agenda item at hand. Public comment will close at the end of the 10-minute public comment period, and no written comments will be accepted after that. Before voting on an agenda item, council staff will read any public comment for receive for the pending agenda item. So with that, if we could have the roll call, please.
Councilmember Banks, Chair.
Present.
Present. Councilmember Moreno. Councilmember Giselson Palmer. Councilmember Brosette.
I'm present.
Great.
Thank
Councilmember
you.
Brosette is present, and Councilmember Gwen present.
Present.
We have 5 members and a quorum.
Thank you, sir. Can I get a motion to approve the minutes from the January 12th meeting?
So moved.
Can I have a second?
Second.
All righty. All in favor, say aye.
Aye.
All righty. Thank you. We need to go directly to Dr. Avegno for her presentation. She has another commitment. So, Doctor, I appreciate you taking time to come and talk to us about where we are with this COVID crisis. So we're going to let you go first so you can get on to saving lives. So please, ma'am, go now.
Thank you, council member. Thanks everyone for having me today. I just want to give a brief update on our status and also where we are with the vaccine rollout. COVID continues to be present in our community, although our post-holiday surge seems to have abated. It is very much here. It is very much present. And it is even more concerning because we know that the new variants, of which the UK is probably the most prevalent here in the US, we know that these are here. We are probably undercounting them. And most experts believe that unfortunately, they will cause another surge sometime in the next month. These variants seem to be inherently more contagious, possibly more deadly in and of themselves. But I don't think I need to remind everyone that this virus continues to kill. We are currently averaging over 2 deaths a day in the city from COVID. That is the direct result of the cases in our holiday surge. And unfortunately, the deaths lag, and that is higher than we have been in a very, very long time. So we are nowhere near out of the woods, and we have to continue to do all the things that we have been doing for the last 11 months. And that is staying home, wearing your mask, socially distancing. As you know, with the carnival weekend coming up, the mayor took some pretty strict actions that really do speak to the tenuous nature and the crisis that we continue to find ourselves in. So we really do urge everyone to adhere to the guidelines through these days. We do not want to have another surge on top of a surge that causes deaths. Getting a little bit to the good news, the vaccine really is our way out. We have been planning for this for months. As everybody has seen, the rollout has been bumpy, and that's from a federal level, and it continues to provide challenges. When I speak to colleagues all over the country, the biggest challenge is supply. There is simply not enough supply currently being sent to the states or in the pipeline to meet the demand. We in Louisiana have done a pretty good job. When it gets to the state, it is rolling out very quickly, and we're consistently in the top tier of states to get it out. But even then, it's a fraction of what we need to be. The state has been publishing twice a week data by region We do not yet have parish-specific data on how well we're doing, and we've asked for that. They're aware of that. They're working on it. It's very, very difficult because of the number of people that are providing information. But what I can tell you about Region 1, which is Orleans, Jefferson, St. Bernard, and Plaquemines, is that we lead the state in terms of percentage of people vaccinated. I expect that when we see today's numbers, it will be over 10% of our population in the region have gotten at least one dose. So that's a really good start. But remember, we need to get to 75% in order to get herd immunity. Vaccines are available at a variety of places, though many have significant wait lists. Hospitals, clinics, pharmacies, urgent cares, and then through the city itself, which I'll talk about in just a second. The lists are available. They are updated weekly. But we know that it can be very challenging for folks to know if they're eligible or to get on a list. So who's eligible right now? Primarily, it's our seniors. It's ages 65 and older, regardless of medical conditions or anything else. Our frontline healthcare workers and other healthcare workers have already most of them have been vaccinated. Our nursing homes are continuing. I'll say our nursing home uptake among patients has been very good in Region 1. Unfortunately, our nursing home staff is not taking vaccine like we would hope that they would. And that's really an area of concern. I know the state is concerned. We are, having conversations with everybody we can to encourage this because our nursing homes really have suffered disproportionately. But if you are 65 and older, you are eligible for vaccine. So how are some ways that folks can access that? Certainly call your provider if you have one and have them help you figure it out. If you go online to our website, it will link you to the state's website, and that's on NOLA Ready, where there's a list of all the providers that currently have received vaccine. Some of them have phone numbers to call, some of them have websites. We know that just going to a website is really challenging for a lot of our seniors, and so we've encouraged everyone to have phone numbers. Please be patient. They're getting hundreds of calls an hour. Call the ones that are closest to you, most available to you. What's probably the easiest for many, and I really want to put out there, is that we've made it such that you can now call 311 anywhere inside New Orleans and talk to an operator. We also have our own online system that's at ready.nola.gov/getvaccine. What that 311 operator can do is when we have doses available through our city sites, and again, we don't get what we wish we did, they can help you make an appointment for that. If you are eligible, they will assess your eligibility, take your criteria. If we don't have it, we are building a citywide wait list. And so we really encourage not only our seniors 65 and older, but also anyone who wants to get on this wait list to please call and get on. What that's going to allow us to do is, as we get doses and we find out week to week what we're getting for the next week, as we get doses, we'll be able to go off of that wait list and prioritize those that have signed up for us. So again, if you're a senior, if you are a family member, neighbor, friend, pastor of one of our seniors, please reach out to those and do this for them. We want to build a very robust list so that when supply eases up, we will be able to pick people off those lists and it will be a lot easier. We've also entered into a partnership with Tulane. They are using our 311 system to schedule about 50 slots a day. That's booked up through mid-March. So we're going to pause and put everybody on a wait list and then open it back up, hopefully with more. What we're waiting for is the Johnson & Johnson vaccine to be approved. When that happens, we'll have 3 different vaccines. And although I haven't seen the robust data on Johnson & Johnson, it is promising that this will be a really important player in the game. When that happens, if it gets approved at the end of February, we are hopeful that that additional 3rd vaccine will be available by early March. That we hope will allow us to really open up the criteria, to really have the mass vaccination drives that we want to and that we need to. It will help us go down to the next tier, which includes teachers, grocery store workers, essential workers, those on the front lines, a very large number of folks that are just sort of waiting and chomping at the bit, as we all are. So that's sort of where we are. I'm happy to answer any questions if anybody has some. It is a little bit of good news, but a lot of patience yet to come.
Now, clarify, who establishes the tiers?
So the CDC Advanced Committee on Immunization Practices sets the overall tiers, and then states can decide whether to adopt them or not. And unfortunately, this has led to a lot of confusion. In Louisiana, we're prioritizing our elders over others, which I think is the right choice because it minimizes the loss of life. In other states, however, they've allowed school staff and teachers to go ahead of elders. Not that that's a wrong choice, but it creates a lot of confusion. So the governor is sticking pretty close to what the official CDC guidelines are, and he said he will continue to do that.
And eventually, you anticipate us getting to drive through and having vaccines available out in the community. I've seen other, for instance, Los Angeles has a walk-up clinic. You don't even have to register. If you walk up, you can get it because they put that in a neighborhood that people typically didn't have internet or have access to computers. So are we planning to do that type of activity?
So we're already doing that activity. So we've been in Central City the last 2 weeks, sort of our first launch. We'll be in the lower 9 later this week. We do have plans to do a smaller drive-through, hopefully in the next 2 weeks. We need to confirm we're actually getting the doses in. We've talked about doing a walk-up, but there's a lot of concerns. That's gone really badly in a lot of places because you have seniors standing outside for hours and hours. And again, the mass drives that are happening now are very splashy, but they just don't have a lot of supply. So people wait a really long time and then they don't get in. So we're trying to do it smartly so that we don't inconvenience everyone. And most of the experiences have been really positive. We make an appointment for you, you come, you're registered, you get your shot, you wait your 15 minutes and you're in and out. But yes, absolutely, we're going to continue to be in the community. We've also started piloting homebound vaccine delivery. So those residents who are on our special needs registry who identify as homebound, New Orleans EMS did a fantastic job this weekend of delivering vaccine to them. This is very, very, very labor intensive. So it's not something we can do for thousands of people, but it's definitely going to reach those folks who otherwise would not be able to get vaccine.
And when we do get to that point, are you looking for volunteers to help facilitate this? Because I've been called by Zulu and Omega and several churches asking how can they help. So what do we tell those folks to if they're not ready for them yet, what do we tell them to get ready?
Well, we have had several hundred folks sign up for our volunteer corps. We could always use more. Our volunteers have been fantastic. So you can go to NOLA Ready and sign up for the NOLA Ready Volunteer Corps. Our Medical Reserve Corps, if you have any kind of medical bent, you're a public health student or you used to be a nurse or something like that, you can sign up there. The logistics of doing a vaccine site are a little more complicated than our testing sites. But if it's an organization that feels like they have space and would be willing to serve as a vaccine site when we get more supply and our strike teams up and running, please have them send their name and information to us, and then we'll reach out when we're ready to go take a look and see if it would meet the needs.
Then finally, walk through the process for me. Once you open a vial of vaccine, and you don't have enough patients lined up to use all of that vial, what happens to the remainder? Are we distributing it to a waiting list, or how does that work?
Right, and that's causing heartburn all over the country. It really depends on which it is. Pfizer is very, very, very tricky because that's the ultra cold one, and once you get it in your hands, you've got 5 days to use it. That's it. Moderna, you can keep in a refrigerator for 30 days, but once you open a vial, you've only got a few hours to use those doses. Now, we're getting very skilled at pulling extra doses out of vials, which is great, but then they need arms to go in. So we've also created this imminent standby list. We've got a list of folks who have said, yes, if you called me at 1:00 on a Tuesday and said you had an extra dose, I could be there. And that's folks that meet the criteria. Nobody wants to give this to someone who does not meet the criteria. So So far, we've been incredibly vigilant. We start early in the morning identifying extra doses. And also we have some people no-show. So then we have extra doses as well. Calling through that wait list, getting folks to us who are sort of on that standby list. And then medical volunteers as well. A lot of them have not been vaccinated, even though they meet the criteria to be vaccinated. So that's the other group we've pulled up. But we are really trying to be diligent about not just making it a free-for-all, as you might have heard of in other places.
To be clear, we aren't wasting any, so we're
Oh,
fine
no.
in all we're putting in it.
No way.
Okay. Colleagues, I see Cindy.
Yeah. Thank you, Jay. Dr. Vecno, I know you and I have been communicating back and forth in reference to District E. Thank you so much for setting up the Global Green vaccine distributing. I think that's tomorrow and Thursday.
Yes.
But I think you and I have discussed about this. So as we're setting up in isolated community like my district, and I get it that, we want to make sure that we help and get the vaccine to the arms of people that are eligible. I think one of the reasons why we set up a task force for District E was to make sure that resident in our district has access to those vaccines. So as you guys are setting up, I would love to see how we can allocate a number of dosage allocated for a resident that lives in that neighborhood, because there's a reason why we're targeting those neighborhoods because of isolation, underserved, disparity. But if we're setting it in there and people in the area are not able to get an appointment, it kind of defeats one of our goals is to address the disparity.
Absolutely. And that is our intent. And, we're learning a lot about how technology works. We have, as we've talked about, we set aside doses specifically for those in the area, working with Mr. Arthur through Global Green. We want to do it more. We didn't realize the site was live. People signed up. It wasn't necessarily the residents. Again, yes, we want to provide for everyone, but we really do want it to go to the places that have been hit the hardest. So that was a valuable lesson. And we're actually meeting to make sure that we are prioritizing folks in that area as much as we possibly can. And then having that, having availability for whatever is not used in that area, well, then yes, we want everybody to have some access. But I promise you, we want to do this right. And it's been a little tricky.
No. And you guys have been very cooperative and very engaging with us. I guess for me was just to make sure that we're to meet part of our goal. And again, everybody in the community, particularly in Orleans, are important for us to make sure that we get vaccinated. But also wanted to focus on areas that we're purposely targeting because of disparity and isolation. Let me ask you another question. Are you seeing a lot of dosage given to Orleans resident? Are you seeing other residents from other parish able to come to Orleans to get their dosage as well?
Yeah, no, we're tracking this really closely. And again, we've been told by the state, you can't say you have to be in a certain parish. And I understand that because we are all affecting each other. I am happy to say that, and I just ran ran these numbers. When we look at the sites that we're scheduling directly, it's far and away Orleans residents, over 80%, 85%. And then very few, only less than 1% has been out of state. So that makes me feel good that and I think limiting it to calling 311 is only something you can do in Orleans. So that helps us, prioritize our residents. Yeah.
And just want to thank you. I think you guys going to be sending a representative from the Department of Health to be part of our task force. I appreciate that. And again, we want to make sure that we stay engaged with you guys in reference to identifying location in our district as we move forward to a mass distributing. That is something that the task force is looking at to help identify non-traditional vaccine locations, so that way we can meet the need of our residents.
Great.
So thank you very much. I appreciate it.
Thanks.
Thank you, Jay.
Thank you. I don't know if we have any other questions. Seeing none, Doc, I know you got to get on and go do what you do. So thank you very much for sharing this information with us. And we appreciate it. Thank you, Doc. We're going to move on with the agenda. So what we need to do now is take the 10-minute recess to allow for the public comment. So we will stand down for 10 minutes and then reconvene thereafter. So,
Councilmember, I'll go ahead and read out the agenda first.
Paul, I'm sorry, I can't hear you.
I'll go ahead and read out the agenda for the public before we take the 10-minute break.
Okay, I'm sorry. I'm sorry. Go ahead and knock that out.
The agenda for the February 9th Community Development Committee meeting is as follows. 1, roll call. 2, approval of the minutes from the January 12th, 2021 meeting. 3, COVID-19 vaccination updates. 4, Orleans Parish Rental Assistance Program. Presenter Marjorie-Anna Willman, Director of Office of Housing Policy and Community Development. 5, a presentation of the New Orleans Food Policy Advisory Committee. Presenter Elisa Munoz, Executive Director of the New Orleans Food Policy Advisory Committee. 6, a presentation of the New Orleans Health Department and the New Orleans Family Justice Center on the issue of domestic violence and strangulation bond data. Presenters E. Nell Noble, Esquire, New Orleans Health Department. Domestic Violence and Sexual Assault Program Director Jocelyn Pinkerton, New Orleans Health Department. Blueprint for Safety Interagency Coordinator Hope Levins, Blueprint for Safety Legal Advocate, New Orleans Health Department. Mary Claire Landry, Executive Director of the New Orleans Family Justice Center. 7, Foreclosure Registry, a presentation of the proposed ordinance creating a registry of properties placed in foreclosure. Presenters Victoria Lewandowski, Economic Development Liaison, Office of Councilwoman Cindy Nguyen. Nicole Heyman, OBES Director, Office of Community Assets and Investment. Jarvis Lewis, Chief of Staff, Office of Councilman Jay Banks. 8, adjournment. That's the agenda for today's meeting.
All righty. Thank you. We will stand at recess for 10 minutes to allow the public comment, and we will reconvene at what time?
At 10:32.
Good enough. Thank you, sir. We stand at recess. Righty, that has been 10 minutes. We are back to order. Next up, we will have Margiana Willman to present details on the rental assistance program. Margiana, if you would, please.
Thank you. Thank you so much. I appreciate you having me here to discuss the city's rental assistance program. We're very excited about the program. As you're aware, the Treasury allocated $25 billion for rental assistance and utility assistance. $308 million was to come to New Orleans. New Orleans was able to apply and receive $11.6 million directly from Treasury because of our population. Any entity with a population over 200,000 was able to apply directly to the U.S. Treasury, which was different from some previous funding that has been available. The city also expects to receive $14 million from the state, which would be the balance of funding available to the city based on population. So the 11.6 was based on 45% of the population of what would come to New Orleans. And then the 55% is the 14 million, the balance. So the city expects to have somewhere around 25 million specifically for rental assistance. There is a 10% that is allowed, up to 10% for administration costs. So the program will begin on February the 15th. Applications will be accepted through Ready NOLA website. Individuals may drop off applications to OCD directly. They can mail them. And then also we're working with the Mayor's Neighborhood Organization, Neighborhood Community Engagement Office, excuse me, to reach out to those neighborhoods where we know that there are high levels of eviction rates. We were fortunate enough to get some data from Professor Davida Finger that pinpointed some of those areas by census tract that have the highest eviction rates. So we have identified some of those neighborhoods and we are targeting those neighborhoods. Some of them are Holly Grove, some parts of the lower 9th Ward, some areas around Little Woods, and Central City as well. So we are also targeting those areas. So the program allows applications from both landlords and tenants. The expectation is that most of the funds will go directly to landlords. A very small percentage would go to tenants when the landlord refuses to participate in the program. And even in those cases, we have to provide that landlord with notice and an opportunity to respond, stating whether or not they want to participate in the program. We're allowing up to 12 months of rental assistance. And also in some cases, some forward assistance may be allowed, and that would be in the case of a tenant who has to move. Say the landlord does not want to participate in the program, just does not want them there anymore. And so in that case, we will help that tenant. We will work with Southeast Louisiana legal services to help that tenant to find additional housing and make sure that they're placed and they're housed. So in those type of situations, we would pay rents going forward, and that is allowed under the program. Priority will be given to households that are 60% and below AMI, and those are households, that's about 42,000 for a family of 4. So just to give you kind of like a picture of what type of households would qualify, the program requires that priority goes to households that are 50% and below, but we thought if we would go up to 60%, we would still reach that benchmark, but then at the same time, we would be able to serve folks that are at 60% AMI as well.
I have a question, Chairman.
Please.
Margiana, thank you so much. So when you talk about AMI and what that means, what about people that have lost their jobs because of COVID, right? They were they were more than 60% AMI when they were employed. They're more than 50% AMI when they were employed. They may have been even more than 120 AMI. So do you take that into consideration when you're using this?
Yeah, so a person, if they're at a point now where they have no income coming in, or they're below 60% AMI at this point in time, they're still eligible for the program. So the program does not say you're ineligible because at some point prior to COVID, you made 120% AMI or a higher amount. People are not automatically excluded for that reason.
Great. I just think we need to push that messaging out there so
Sure.
people don't, because a lot of these programs, right? You have to present your last pay stub or what have you, and that's going to be quite higher, when you were working.
Correct. And one thing I would like to say about these funds, unlike the Treasury funds, unlike a lot of the HUD funds, have very, very hard limits. This program was designed to get the funds out very quickly. And it's extremely flexible. It allows for some self-certification in certain situations, but we have a lot more flexibility than we would have had before. So we have worked very hard and tried to eliminate as many barriers as possible to individuals that need assistance who may be hesitant about applying. So we've worked with Fair Housing, GNOFAC. We've worked with Southeast Louisiana Legal. We've also heard from some landlords. We've been also working with the first and second courts just to make sure we have a well-rounded program. Our applications, as you may have seen, I think copies of the applications were included in your packets, but they're very short. The tenant's application is 3 pages. The landlord's application is 2 pages. And there's a lot of flexibility in the type of documentation that we're able to receive to support their claims of need. So just to make sure that information is out there as well.
And then Margiana, what we've also seen in a lot of our districts are people that have then had to move out of other housing, move in with family members. Mm-hmm. And other people that might be paying rent. So do you look at the entire household? So then basically one person may be making more than 60% AMI, but they're also caring for and supporting other people who can't pay and had to move in with them.
Absolutely. It takes into consideration the total number of household members. So you'll also see that on the application. For the tenant's application, it'll list, they can put in all of the members of the household. And so it does consider that as well. So it's not just the one person, but it's the total size of the household.
Great, thank you.
Mm-hmm. Okay, and so priority is given to the 60% and below AMI households that are high risk for homelessness or housing instability. That would certainly be a household that have received maybe an eviction notice or really on the verge of becoming homeless. This is not a program designed to assist folks that are already homeless, but this program is for rental assistance and to keep folks from becoming homeless. Also, a priority goes to any household this is a minimum threshold requirement, but where it's COVID related. So the loss of income has to be, there has to be some type of loss of income or hardship that's tied to COVID. And then also the state has asked and has made it one of the conditions for the remaining $14 million that Louisiana Emergency Rental Assistance Program applicants are given some type of priority as well, because there are many of those applicants that they were not able to serve, and we want to make sure that they're able to receive assistance as well. And I'm happy to answer any of your questions. And I also just add that we are putting all of our documents on the Ready NOLA website. We're working also to have them converted to Vietnamese and Spanish, and we will have the ability to have an interpreter here to assist any individual that needs assistance during the intake process.
Council members, this is John Pusho. Good morning. I just wanted to say a few words. This is a really big deal. And it really is a testament to the work of Margiana and her office and her people that we're able to get this off the ground so quickly. Part of that is because the work had already been started to create the program itself and trying to be flexible with existing dollars that we had to put into this program. So whereas other cities, parishes, municipalities, and even the state are working to build something right now, the fact that we started on this and that the mayor realized that this was going to be a big deal before we had access to the money that we have now allowed us to get a jump start on creating the types of processes and the work that we know needs to be done. And so we're really excited about this. I think this is going to be the biggest issue in housing for us and the largest priority for the mayor for the rest of the year, making sure that these dollars are able to get to folks so that they can stay in their homes and so that they have some housing security.
John, thank you. Clarify for me, do the payments go to the tenants or do the payments go directly to the landlords?
Yes, so payments will go directly to landlords. There may be a very small amount of circumstances where a landlord just does not want to participate in the program. And we will work with that tenant to make sure they're able to maintain housing and they stay stable. But the majority of the payments will go directly to the landlord.
And the tenant can apply, but the landlord can apply also. I want you to make that clear that they can come in too.
Yes, sir. And it is required that we receive information on the tenant. The tenant has to be notified when the landlord receives payments. That's one of the requirements for a landlord to receive payment. He has to agree that those tenants will be notified that their account is now cleared. Once they receive payment, their accounts will be brought up to current. In any situation, the point is to make sure that the account is current. And also, I just want to say that Treasury has required that demographic information is provided quarterly. And we want to look at that as well. We want to make sure we're hitting our target groups, populations. We want to make sure we're serving the folks that need it most. So we are gathering demographic information, and that information also has to be reported to the Treasury on a quarterly basis.
Walk through the timeline for me. Ms. Smith applies
I have
today.
a question, Jay.
Okay, give me a second, Cindy. Walk through the timeline for me. If Ms. Smith comes in and applies today, how long does it take to actually get this process? How long does the landlord have to wait to get the payment?
Okay, so the applications, the round opens February 15th. So, it will not be until February 15th. We will receive the applications, but we will not start processing them until February 15th because that's when the program starts. But once we receive it, we will go through the application, determine preliminarily if that applicant is qualified. So the first thing we want to do is make sure they're in Orleans Parish, because in some cases, people will apply. We're getting a lot of calls from other areas. Primarily, well, I don't want to say that, but some of the reason is because our program is the first to get started in the state. So a lot of people are anxious for their area to get started, and they're even looking here to see if maybe they can get some assistance in New Orleans. But once we receive that, we will reach out to the, once it looks like they're preliminarily approved, we'll reach out to them and make sure we have all the information we need. We're also working with some of our nonprofit partners, one of them, to verify that there's no duplication of benefits, which is also very important for this program. And when I say that, I mean that we cannot use these Treasury funds for a month where they receive some type of other federal assistance to pay rent for the same month. So we have to make sure there's no duplication of benefits. Once we have gotten that information and we're certain that there's no duplication of benefits, we have all the information that we need, then we will determine how much they'll receive. We'll meet with that landlord. The landlord will sign the agreement with all the terms in there, and that information will be transmitted to Hanno, who will make the payment. We're working with Hanno because they have the capacity and the staffing to issue payments very quickly. So our goal is 10 to 14 days. We plan to move very quickly. We are getting in temporary staff through Job 1 to assist us in the intake process, and we'll move as quickly as possible. Of course, there are some factors that we don't know. We don't know how many people are going to apply. We know it's going to be highly sought after, but our goal is 10 to 14 days.
And the anticipated grant will be to cover 1 month, 6 months. What do you see the impact being to help out the renter and the landlord?
Sure, it can pay up to 12 months. It has to start beginning in April. It has to be COVID related. But it can go up to 12 months.
So it can help someone who is in arrears and someone who is still unemployed or underemployed because of COVID.
Yes, that's correct.
Okay, thank you. Cindy?
Yeah, thank you, Margiana. Thank you so much for setting this program up. I've been promoting it and been forwarding the application out to people. So is there a cap on rental assistance per month that the program is looking at?
Yes. So, we want to reach the most households as possible. So the cap is the 110% of the fair market rate in certain zip codes and for disabled households. Other than that is the fair market rate. And so it's kind of in line of what Hano pays for rent. They pay 110% in those situations. Otherwise, it's a fair market rate. And I can tell you what those rates are. For efficiency, it's $779. For a one bedroom, it's $908. 2 bedroom is $1,078. A 3 bedroom is $1,396, and a 4 bedroom is $1,597 per month. So it may, in some cases, be less than what that landlord would typically receive for rent. But we're hopeful that they would be willing to settle on that amount.
Got it. So my other question is that I think originally the funds that we receive from the federal government is for rental and utility assistance. Is the city looking at some sort of utility assistance program as well through this fund in the near future?
I know the city, there's a lot of work that's going on the utility side, but these funds are specifically going to be used at this point for back to rental assistance.
Okay, and do you guys have a deadline in reference to when they have to apply for the renter and landlord financial assistance program?
No, ma'am, there is no deadline. We will keep the program going as long as funds are available. And we're hopeful that additional funding will come down from the federal government as well.
Yep, Councilmember, unfortunately, I think this is a program where we're not going to be sitting on money at the end of the day with this, with the $25 million number, or even if it's significantly higher. As you all know better than I do, the need is so great that a deadline won't be our issue. I think running out of money will likely be our biggest issue.
Yeah, and again, I'm very hopeful, because even like the council did the utility assistance for unemployment individuals to help with their energy. And, I was very shocked that we didn't get the response that we thought we were getting based on the outcry of the rate of unemployment. And so I'm just, and I think what we're hearing also is that because of the cost of living and COVID-19 with other costs going up, and then with us experiencing cold weather, people are experiencing high utility costs. And so then they're home more so now because of COVID-19. So while, I'm always exploring federal programs that could really assist those that we were not able to assist through the CCC Care program when we launched that last year in reference to helping unemployed individuals that were affected by COVID, but that did not apply to everybody.
No, you're right, Councilmember. And look, I think there are a couple of lessons learned for us. One of them that Margiana already spoke to is staffing up to make sure that we can do the intake as well as possible, and to make sure that we can coach people through these processes. This is difficult stuff for people who may not have a lot of experience with it. But we're also hopeful, just to say it, on the federal side, that additional utility assistance would be part of any federal package that would come down. So we say that to say we're always going to be open to solutions and trying to make sure that we're helping our people. As of right now, the focus is more on the housing piece than the utility piece, understanding that they're very related. But we'd love to continue to work with you to see what other options there might be to help people with their utility bills.
Yeah. No, I think, like I say, this is a great program. I'm getting a lot of positive feedback from my constituent. I've been promoting it via my Facebook Live and even made printed hard copies and been distributing it out because I know people may not have access to a printer, and so we're very mindful of that. And so for those that are listening, my office do have hard copies, and I'm going to try to maybe even if we could get neighborhood engagement, because I know that they are in our community, if they can also have hard copies at where they're set up, I think people can come and pick it up as well for those that don't have printer.
Yes, ma'am. That's a great idea, especially with us starting back up with office hours. So I'll touch base with Ray today on that. I think it's a good idea and low hanging fruit.
Yeah, and John, just on that, do you think that maybe they could also receive the application for OCD? Because I know OCD, you guys are off of Portrait. So I'm thinking of those that don't have transportations. And I know that they could mail it in as well, but just trying to be utilizing neighborhood engagement as a way.
I love that, council member. I think it's a great idea, and Marjoriana's shaking her head. So it might be such a good idea that folks have been talking about it already. I'm not aware of it, but I can tell you we're going to do it because I think that's a great.
That would be great. I know Jared was at the P. Sanchez building last week, and I was able to engage with him, and this will keep him busy. I know he stays busy already, but just trying to really get people to connect to what we're providing in reference to neighborhood, like those satellite offices.
Yes.
And we don't want our folks bored, So, but I think this speaks to why it was important to do the office hours piece before, because the applicability of it works with so many different pieces, right? It's the information we can get out, but it's also hopefully the stuff that we can bring in. And this is a really good example of, how we can make City Hall a little more accessible for folks in their community. So I love the idea, and you have our commitment. We're going to do it. And if there's any problems with it that are not noted at this point, we'll let you know. But I think it's a great idea.
Yeah. And, I know you guys mentioned that you guys have translator, if you need my limited Vietnamese speaking skills to help those that speak Vietnamese, I'll be happy to make my time available to assist those individuals as well.
Councilmember, we'll definitely take you up on that. We do all that we can get, and we appreciate it.
No problem.
Thank you so much.
Just one other question, Marjan. I got a text asking, are there any housing standards that are attached to the landlord receiving the grant?
There is not for this program. There is not.
Okay. Thank you. Do we have any other questions, colleagues?
Is there a reason why, Margiana? Because if we're paying for them to have housing, and if it's not safe, if it's not decent.
Councilmember, I think the one thing with this, it's a bit of a balance, right? And I think this is a situation where we could definitely talk some more in depth on it. But I think the concern is, especially if the focus is on making sure that folks stay in the homes that they want to stay in right now, right? So being able to use these dollars to be in the places that they are, even understanding that, you can use these dollars to get different places. The balance between how long it takes to certify, how long it takes before that money's in there, so that you're not in a situation where there's such a lag in the application process that folks aren't going to be able to avail themselves of this, so they can't get buy-in from their landlords. It's an issue. As you know, the mayor has always been a big advocate of making sure that we improve our housing standards, but it's trying to find that balance so that we have a process that's easy enough for our residents to avail themselves of in their homes, while still trying to make sure that things are above board. But having said that, I think that's something we could talk a little bit more about. Marjoriana, did I miss anything on that?
No, I agree with you, John. The purpose of part of the purpose of this program is to keep people housed. Certainly, if someone wants to move to a new location, we can, make sure we can maybe check in those situations. But the point is to, keep housing stability and keep folks housed.
And I hear you guys. I guess for me is, and I'm Jay, thanks that person that texted you on that question, because we continue to balance quality of life, nuisance issues, and then, even showing some support for code enforcement, because we have situation where people are living in deplorable condition. And I guess, can we leverage or even verify, because I think that code enforcement is doing their job. They're holding these people accountable to make sure that they address these conditions. But then on the other hand, we are also paying them to provide housing. And I fully understand where you guys are coming from. So don't get me wrong. And I think, John, you hit the key is, how do you balance during time of crisis, right? To make sure that people have a place to live. But then if we're using federal dollars to pay someone, a landlord that is not providing quality of life, we're in a way kind of feeding into that is okay that you don't take care of the property that you rent out to people, and you're still benefiting from the federal government. And I think it's a very sticking line, but I understand the condition and situation we're in right now with some of our residents, because there's not other housing facility available. But it is a great concern, something that my office continued to battle with, particularly landlords who just benefit from the money and not reinvesting back into the house that they rent out to. And they're benefiting for tax dollar money, and then not really taking care of their property. And that is something that I have hard time swallowing.
It is a real issue. The housing quality concerns that we have in the city have certainly not gone away during COVID. I think the one other thing that I would say, and I think this is a little bit different for us compared to some of our other tools that we've tried to use in relation to this, is that the tenant has the power in this specific situation, because the money follows the tenant, not necessarily just stays with the landlord. So even though landlords can apply for it, if this is a situation where, that resident wants to use that money to pay for staying in a different place, the fact that they're able to do that provides a little bit more leverage than in other situations where your options are, get this place fixed because I can't go anywhere else. And because I'm not bringing money to a different situation. Having said all that, I think continue to work on some of our housing quality pieces are a big deal. But the other thing that I would say that I think is really important about this program, and I think it's really actually new comparative to other things when we talk about the strings and making sure that we're getting the most we can for the revenue we're putting in, is that you cannot evict your tenants for 90 days if you accept this program, other than for purely illegal activity. So it provides not just some housing security based off of the back rent piece, but going forward, it provides that additional security. So we're not in a situation where we're paying somebody to make them happy on the back end, and then they turn around and kick somebody out of their home. And so, I think that's a really big piece. It's profound. It's definitely a piece that we're really proud of putting in place on this. And it's an example of making sure that we're trying to be strategic as we're also trying to be quick and efficient with those dollars.
Yeah, no, I get it. And I think it's something, and I know the administration is very committed in improving the quality of life, dealing with a lot of our housing stock. So I appreciate that greatly. I also wanted to, and I know, I asked about the energy assistant, but I know that TCA, Total Community Action, I forgot to mention that for our listeners, that Total Community Action has energy assistant funds available under the LAHEAP program that could assist people. And then they also have crisis funds that are available too. So for those that are listening in, that are in need of energy assistant funds, TCA is also a good source. But back to the question, Margiana, I also get emails in reference to individuals that has a mortgage, but is unemployed and cannot pay their mortgage so they can stay in their home. Are we looking at a program to target those individuals, to assist them as well?
Yes, so we are working on that, and more information to come soon, but we are working on that as well. We have identified some funding that we may be able to use for that, and so more information will be coming soon on that program.
Great. Can you please make sure, and I know you guys do this regularly, but I definitely want to stay engaged in this conversation. And Jay, thank you so much for bringing this to the Community Development Committee and keeping our public educated about it.
Margiana, just two other questions.
Mhm.
The payments are good for a year, or how does a prepayment work? Or do they have to file monthly, or do you give the landlord a check for a year? How does it work since it's up to a year?
Yeah, so up to a year is for past due arrears rent. So that'll be calculated during the intake process, and that'll be what is paid to the landlord. We have the option to pay 3 months moving forward, and that would be strictly in situations where either the landlord does not want to pay, or in a situation that John explained earlier, where you have a tenant that no longer wants to live in that unit. For whatever reason, we will assist them to move to another unit, pay for 3 months of rent going forward, and a portion of the back due rent to help them get settled into for deposits and any other costs that would be incurred during the move.
There is no requirement that a recipient be X number of months behind, correct?
Oh, there's no requirement as long for whatever is behind. It could be 1 month, 2 months, 3 months. Some are partial payments where there's some tenants who did pay as much as they could, but there's still a balance. So we can go up to 12 months, but it's whatever is actually owed minus fees and court costs, that sort of thing. So there is going to be some give on the landlord's side. I also wanted to add, in addition to the landlord can evict for 90 days, we also put in there that they can evict for 91 to 180 days for, it has to be good cause. So if it's something that tenant does, that is a good cause reason for them to be evicted based on their agreement, they can be evicted. But otherwise, our hope is to keep those tenants in place, stabilized, housed for as long as possible. And in this case, 180 days.
And just my final point before we go to public comment, would you again state how does a citizen apply for the program, just to make that clear for everybody?
Yes, so absolutely. So they can go to the Ready NOLA website. We have applications here also at OCD. They can drop them off at OCD, which is at 1340 Poydras on the 10th floor. They can mail them in to OCD. And then also, as I spoke about earlier, we're working with the Neighborhood Engagement Office to go out to neighborhoods where we know there are high eviction rates by census tract, and we will receive applications there. We'll have copies, they can fill them out, and we'll receive them there as well, very similar to what Councilwoman Gwen mentioned. And they can also call in. We will fill out, if they call in, at the 504-658-4200 OCD number. We will also take applications by phone. So we're doing everything we can, again, to eliminate any barriers that will keep folks from getting assistance.
Thank you. I think we had one public comment. If there are no other questions, we'll go to public comment. And I don't see any of my colleagues. So with that, Jarvis, if you would, please.
Yes, sir. We have one public comment on this item. It's from Lilith Winkler Score, who is not a paid representative. And the comment says, "Dear council members, as we weather this pandemic, our low and moderate income homeowners are incredibly vulnerable. Without protecting these New Orleanians, the wealth that they have worked to build for themselves, their families, and generations to come will be wiped away. We will continue to see the racial wealth gap expand, and we will be even further behind in our goals to have a thriving city with prospering residents. We need a foreclosure registry immediately in New Orleans."
Thank you, sir. Margiana and John, thank you both. We appreciate the information, and we will keep intentional on sharing information, but also keep trying to find more resources so that we can keep our citizens in their homes. Being able to live in your house is something that's absolutely critical. And this city has a real need for affordable housing, and everything that we can do to help keep people where they live, we're going to be intentional about trying to make happen. So,
Councilman.
Thank you, Mr. Chairman.
Thank you so very much.
Everyone, it looks like we lost the council chamber feed. Give me 1 minute, we'll try to fix it.
I can introduce the next group if that'll just to move things along.
We want to keep,
Do
let
that?
me just check in on Granicus. I'll be right back.
All right, I just heard from Chairman Banks, and he would like me to introduce the next group. I do see that we appear to be on broadcasting on Cox. So with that, I will introduce agenda item number 5, which is the presentation of the New Orleans Food Policy Advisory Committee. Presenter, Elisa Munoz, Executive Director of the New Orleans Food Policy Advisory Committee. Great to see you, Ms. Munoz.
Thanks. Thank you so much for having us. Will our slides come up? If not, I can just talk through everything.
Pulling them up right now.
Okay, great.
Able to put up your slides as well, though.
There we go. And I will make it short and sweet because I know that we all know each other at this point. So again, I'm Alyssa Munoz, and I'm the Executive Director of the Food Policy Action Council. I'm here with my colleague, Bryn Como, who will be co-presenting with me. Next slide, please. Great. We all know each other here, but just as a reminder, we were formed in 2007, actually, through a resolution from the mayor's office and the city council. We've been through many, many years. And in 2016, went through a period of a lot of growth with assessments, and we received funding. Today, we are actually our own 501c3 because we've received enough funding and stable funding to employ both myself and Bryn full-time, which we're really excited about. And in the process of doing that, we have changed our name. to the New Orleans Food Policy Action Council, now that we are doing programming and policy advocacy and have just really grown a lot. We feel like this reflects that growth. Next slide, please. So as you can see, we have quite a few members and partners of FPACs. That all informs our work, because you can't make or advocate for policy in a vacuum. Well, you can, but it's not a great idea. So we have, some smaller nonprofits, and then we also have much larger nonprofits and partners. We have New Orleans Public Schools as one of our close partners right now, the Health Department, American Heart Association, Second Harvest, GrowDat. You can see that we have, quite a few partners that we work with on a daily basis. Next slide, please.
So within FPAC, we've got working groups, and it's where the majority of our work takes place. Our 4 areas of focus are food business development, which there's a lot of work to look forward to as far as food business development goes for food business recovery due to COVID-19. Food access helps folks find and get food. They also assist with policy updates and alerts for the general public. So they've been great disseminating information as far as pandemic EBT and SNAP benefits and changes with unemployment and all of that. Food production works with urban farmers and growers to increase the benefits of urban agriculture in our communities. And food waste and recovery addresses an area of the food system that's often overlooked. Food waste dealing with compost and recycling, and food recovery dealing with rescuing surplus. Next slide, please.
Great. So we've been doing a lot of work during COVID-19. Most of it has been what I call policy translation. So a lot of the policies that have happened have been at the federal and state level. We have been taking that information and trying to disseminate it in a way that makes sense to residents, community members, and organizations. One big project that we did was spreading the word about pandemic EBT. We advocated with the state for some changes around how families applied, and then also to open it back up in September. But we actually worked with the school system, or the Department of Education and Department of Child and Family Services, to make a flyer that we then translated into 3 languages, and we had at every school meal pickup location so that we could really get it out there. As well, NOLA Ready put it on their Twitter, and they did a text message for that. And so we're really proud of our work with pandemic EBT, just getting the word out. As well, I wanted to let you all know that recently, with the change of administration, now pandemic EBT will be available for children in childcare ages 0 to 6. The state plan for that is coming, so we don't know that yet. We should know soon, and I will let you all know. It's a little more complicated than school food because there's so many different types of childcare. There's licensed facilities, there's family childcare, that kind of thing. So we want to make sure that as many children that are eligible can get it. But that's huge because that age group has really been left out of so much, of the recovery. And we know that those are formative years. So stay tuned for more information about that. We will revise our flyer, and we will do a major push on the early child care education pandemic EBT. Next slide, please. Another thing that we did that was a major undertaking, as you can see by this flyer, is we realized that there were so many different ways to get food assistance, and for so many different types of people, whether you needed emergency food, whether you needed food delivered to your house, if you needed grab and go food, if you had SNAP, but you wanted to make it, you wanted to extend those benefits. We worked with all of our partners, and we made these, what we call food access flow charts. So they go really, they're sort of broad, but also in detail. And we have done some specialized ones. So one area that we've noticed is a big gap is for our seniors. We know that so many of them are already food insecure, and now they're also homebound and even more food insecure. And many of them may not live with family, and family isn't coming by because of COVID. So we are doing a special program to reach out to our seniors in the parish, or in Orleans Parish, to try to really connect them with food access resources. So we have a part-time staff member who just works on this. So we realized that the usual means of getting information out, like email, weren't working. So now Haley, we have a hotline, and when a senior calls in, she will, walk them through what food assistance could they be eligible for. And if they're eligible for some that need paperwork and are often done online, we actually have these folders where she drives them to their house and does a no contact drop off. And then they can call in, they set up a call time. She walks them through the application, pardon me. And then she actually goes, picks that form back up, kind of looks through it to make sure that they have filled out everything and signed it. And then she mails it to the Department of Child and Family Services, which deals with that. So it's been working out really well. And we've noticed that there's a huge need. Like, our call line is very busy, and seniors is a really special group. It can tend to take 3 hours for each person to walk them through it. So it's definitely a need that we're trying to reach. And you may have seen these flow charts and these handouts at any of your district food drives or food pantries, because we have been getting them out there. Please don't ask me about our printing budget because it is blown out of the water this year for good reason. We also have these still available, and we are glad to get them to you. We also have been keeping up with changes. So school food, we did we revised one for food that was available during the holidays. We are now about to revise it again for food that is available during the Mardi Gras holiday. So we can really keep families knowing how they can get food as soon as they need it. Next slide, please.
And that flow chart is available in Spanish as well.
Yes. And we can get it in Vietnamese. I think we may have it. If not, we can get it rather quickly. So just to remind us all of the great work that we've done together between Council and FPAC in the past few years, we all worked together on the small box retail diversity study and recommendations, which I think were a huge success and win for the city in general. And really excited about that, especially now that we know that folks aren't going too far from home to get food. The Fresh Food Retailer Initiative was a project of FPAC and the city, and that helped open the Whole Foods on Broad, reopen Circle Foods, and was a $13 million project. In the Healthy Corner Store Collaborative, which has also been very impactful during this COVID time. We also worked together last year, 2 years ago. What is time right now? On our farm to institution resolution, and we're still working on trying to get fresh local food into hospitals and universities, which we know is even more important than ever as there are more people in the hospital. And we know that having increased food-related diseases, is one of the things that can make you more susceptible to COVID. And then we've also worked closely on the city feeding program. We did some work that informed that grant ask, as well as been helping get the word out. And the city's food insecurity task force, all the meetings we have been saying, here's the policies that are coming down. Please get this out to all the folks that you serve, because we know that emergency food is fantastic and definitely needed, but it can only go so far. And now that this has stretched on for a year and we don't know how much longer, we're really trying to figure out more sustainable ways to help folks, such as SNAP, such as WIC, such as free and reduced school lunches. SNAP is actually the #1 helper of food access and helping people climb out of poverty in the country. So we want to get as many folks as are eligible onto it. Next slide. What are we looking forward to this year? So much. On the local level, we are, like we talked about with seniors, we're also looking to do outreach to veterans because they're another very vulnerable group, to increase their SNAP participation and figure out how we can connect them with things like Market Match and doubling SNAP dollars at certain retailers. We're really looking at how we can help our food businesses. So many restaurants and small businesses have shuttered, which means we have a city full of folks who know how to cook amazing food who are unemployed right now. How do we kind of harness that energy and help them build new economic opportunities? So we're looking at how to do that through equitable and streamlined permitting and licensing, because we found through our policy assessment that that's the number one kind of barrier to either starting your food business or growing it into something where you can employ people. So we're looking at how we can help inform those changes. And then it's something that we're doing that we're really proud of and excited about is a COVID-19 impact survey. So we are trying to figure out what has been the impact of COVID-19 on our food system, from how much emergency food people are getting to changes in school food, SNAP enrollment, businesses who are closing. I can't think of the other ones, but we're trying to get it out to as many folks as possible. And then what we want to do is look at how has COVID-19 impacted us and how can we be ready for, the continuation of this, because even when we're all vaccinated and it's under control, the economic and health effects are still going to continue. So how do we look at policies that can really help with that recovery? And then also, in Louisiana, we have a lot of disasters and it's possible we will have more. So how can we have disaster plans that include food access and include healthy food access? So we're hoping that will inform, this study will inform that. Statewide, we are establishing a statewide food policy council network so we can all work together and advocate at a state and national level with a lot more impact together. And then we're establishing a statewide farm to early care education action plan. Again, that age group is the one that makes the most, having healthy food makes the most difference in the success in your life. So how do we make sure that they are getting fresh, healthy food, because they are not bound by the school food rules. And there are many centers who aren't participating in CACFP and all sorts of different programs. So we're working to create a statewide network on that. And then on the federal level, it's a lot of advocacy with the change in administration. There's a lot of changes around food access. A great many of them are positive. There's a lot of money for programs in the $1.8 trillion stimulus plan that is being pushed through. So we're hoping to really advocate on how that can be spent in a way that makes sense and is equitable. And then I don't know if we have let you all know, but the USDA in the last Farm Bill created an Office of Urban Ag Innovation, and they are having 14 county committees. And New Orleans, through our hard work with our farm partners, was selected as a site for that Urban Ag, Urban Ag Farm Service Agency County Committee. So that means that New Orleans will really be helping to shape the, the USDA, what they consider urban ag and how they work together. Because only in the last Farm Bill was urban agriculture even recognized as agriculture. Next slide, please. Okay. If you all have any questions, we are here. If you all need any of our flyers, we are glad to drive them to wherever will be the best place. We can get you whichever one's translated that you need. And if you need it in another language besides Spanish or Vietnamese, we can also do that. But thank you.
Thank you, Councilmember Moreno.
Thank you so much. Quick question. So you were talking about a policy assessment around kind of helping out restaurants and small businesses in the food industry. How long do you think it's going to take to complete the policy assessment? Because I'm really interested in your recommendations.
Sure. We are in the process of trying to get as many responses as we can, and then we'll be crunching the data. Actually, the sector that we've gotten the most responses has been food businesses, but we're still trying to get more. So I would love to send you all a link to it. And if you could send it out to any of the food businesses in your districts, as soon as we can get enough numbers to kind of have enough to make sense, then we hope to do that. But in the next few months, without a doubt. And there are some recommendations that we're working on now, just seeing how it's how the responses are shaking out. And most of them are around permitting and licensing, because that is a huge barrier. In order to do a pop-up just one time somewhere, you need 7 different permits, and it costs $700, which is a lot for a small food business who's just kind of trying something, or wants to do it but aren't sure, or doesn't have a job and is having to, really pay for everything out of their pocket until they start doing this.
Yeah, I'm really interested in this. If you could send me more information, I'm happy to share it so that you can get more businesses to be part of your survey. But I'm very interested in really learning more about the permitting barriers. So, I believe you've got my contact information. If you don't, I'll give you my email address. I feel like everybody's got it anyway.
I've got it, right.
Okay. If you could just send it to me, that would be great. And I'll have one of my staff members take the lead on it from my office so that we can stay in constant communication on this. But overall, I just want to thank FPAC for all the great work that you do. You always keep us up to date on everything that you're doing, and continue to, work with us on a variety of different matters. So like I said, I just wanted to thank you for your work, particularly now during this pandemic when it has mattered so much. Thank you, Mr. Chairman.
Thank you.
Thank you, Council President. Do we have any other comments from my colleagues? Jarvis, do we have any public comment?
No, sir, no comments.
All righty. Well, ladies, thank you all.
Thank you.
We will proceed on with the agenda. Next up is a presentation from the New Orleans Health Department and the New Orleans Family Justice Center on domestic violence, strangulation, and bond data. Now, I got a couple of inquiries as to why was this on community development and not on criminal justice? Well, the fact is that the lines between criminal justice and community development overlap, intersect, are very blurry. All of this is about our community and about helping to make our community better. So this problem is very, very, very prevalent. And while it does come under criminal justice, it certainly does come under community development too. So those of you all who had concerns, I don't see a conflict. And at the end of the day, I think all we can do to make our community better, whatever committee it comes under, I think we ought to explore that. So with that, let me introduce E. Nellie Noble of the New Orleans Health Department, Joycelyn Pinkerton of the Health Department, Hope Levins of the Blueprint for Safety, and Mary Claire Landry of the New Orleans Family Justice Center. And Council Moreno, did you want to comment first? If you would, please.
And I also wanted just to agree with you on the fact that this particular issue is in the Community Development Committee, because as you see, the presenters today are actually from our health department, because this is actually being viewed as a health crisis. And so we are very much approaching it that way in the city of New Orleans. And Dr. Avegno, along with her team, have really done a tremendous job in looking at this from a health perspective. With that being said, we have been really digging deep on these domestic violence cases in our city. And really, we've been looking throughout the state, but we've been really focusing in on some of those most severe cases. And those most severe cases have to deal with where there is strangulation involved. And so our health department really did a deep dive in taking a look at those particular cases, and they'll be able to explain why these cases can become so dangerous. And then based on that information, I think it's important that we move forward with certain policy decisions, that the judges move forward with certain policy decisions, based on data that we're seeing nationally and here in New Orleans. So that's why I thought it was really important for, of course, our great folks over at the health department, but also for Mary Claire Landry from the New Orleans Family Justice Center to be here as well, so that we can fully understand this issue around these domestic violence strangulation cases and the true severity of these cases. So with that, I don't know who's gonna start, but you wanna start now? Okay, go ahead now.
Yes, thank you so much. Hi, everyone. My name is Nell Noble, and I am the Domestic Violence and Sexual Assault Program Director at the New Orleans Health Department. I just want to take a moment to thank Councilmember Marino for inviting us to present today, and to thank the entire committee for this opportunity to be here today. This domestic violence strangulation report is really an example of what our team at the health department does really well. So we're able to take a deep dive into the data and present it to our partners and the broader community to hopefully influence policy decisions like Councilmember Moreno was mentioning earlier. I know the members of this committee are aware of the seriousness of domestic violence strangulation, and we've often heard from our partners in the advocacy community, such as the Family Justice Center, that bond amounts may not always reflect the severity of those offenses. Here with me today are two of my colleagues from the health department, Jocelyn Pinkerton, who is our Blueprint for Safety Coordinator, and Hope Levins, our Blueprint Legal Advocate. They're going to present more in detail on our report. So thank you again.
Okay, thanks, Nell. So if we can go to the next slide. So like Nell mentioned, we took a look at strangulation charges from November 1st of 2019 to October 31st of 2020 to look at bond amounts in particular. And that's thanks to our friends over at the Office of Criminal Justice Coordination helped us with obtaining some of this court data. I also wanted to echo Councilmember Moreno. You know, there are sort of two aspects of strangulation in particular that make this significant. First of all, strangulation can cause really detrimental and dangerous health impacts for victims. But second of all, strangulation can also be sometimes an indicator for risk of future violence in intimate partner relationships. So these cases are something that we really want to keep a close eye on. So we looked at cases in which defendants were charged with either domestic abuse, battery, strangulation, or battery of a dating partner strangulation during that time period. Next slide. Okay, great. So one thing we were kind of curious about is how COVID-19 might have affected bond amounts. And so you can kind of see when we looked at average bond over time, you know, the end of 2019, we were looking at maybe around $3,000 per strangulation charge. And then sort of in the early months of the pandemic between March and July, bond amounts definitely went down, hovering closer to $1,000 per strangulation charge. But now it seems like they've gone back up again quite a bit at the end of 2020 to closer to ranging around $3,000. So just to give folks an idea of kind of the amounts we're looking at and some of the trends we've seen over the past year. Next slide, please. So when we looked at bond amounts, we also really wanted to see how much bond amounts correlated with the amount of time that someone spent in jail. So, you know, part of issuing bond is assessing how much risk that person might be to public safety in the future. So during this time period, we had 255 individuals were charged with strangulation and released from jail within that same year. And we wanted to see what impact that had on the amount of time they spent in jail. So I'll turn it over to Hope, is going to talk a little bit more about some of the data here.
Yeah, thanks, Jocelyn. So yeah, to echo what Jocelyn said, we went to look at those bond amounts and see how that correlated with time spent in jail for the individuals who were charged with charges of strangulation. So first we looked at the folks who were given lower bonds, and in this report, lower bonds are $1,000 or less for those strangulation charges. And what we found was kind of to be expected. Right? So we found that lower bonds correlated with less time spent in jail, and less time spent in jail is about less than or equal to 3 days in jail. And if you look at the graph at the bottom, you can see on the left-hand side that represented there. And, you know, majority of folks given these lower bonds spent less time in jail or less than 3 days. But when we looked at folks who were given higher bonds, over 1,000, it didn't necessarily correlate with more time spent in jail, as people often think of. So about 53% of individuals who received bonds over $1,000 spent 3 days or less in jail, while 47% of individuals who received bonds over $1,000 spent more than 3 days in jail. Again, indicating that defendants with bonds over 1,000 were equally as likely to spend 3 days or less in jail as they were to spend more than 3 days in jail. Next slide, please. So we looked at kind of those initial correlations just to see, lower bonds versus higher bonds, what that looked like, and how much time individuals spent in jail as a result. But we also wanted to look at some other factors as well. Some of those factors included folks who were given multiple charges on top of the strangulation charge. So if they had a domestic abuse battery on top of the strangulation charge or other charges on top of that initial charge in one incident. We also wanted to look at folks who had previous histories of domestic violence at Orleans Parish Criminal District Court and see if that had any impact on bond amounts or their length of time spent in jail as a result. So we looked at about 53 cases from August to September, and we looked at a small sample of cases so that we could go into Docket Master and see those histories of domestic violence and also see how many different charges those individuals had. And upon examining that small sample of cases, we found that although defendants with multiple charges were more likely to be given higher bonds, so they're about 80% more likely to be given bonds over $1,000, as opposed to individuals who received one charge, they were also more likely to spend less time in jail than those with one charge. So if you look at this graph here at the bottom left, you see that these folks, this is defendants with multiple charges. Overall, they're spending, whether they were given bonds of $1,000 or less or not, they're spending less than or equal to 3 days in jail. So multiple charges didn't have a huge impact on more time spent in jail. We also found that defendants with domestic violence histories, so it was about 30% of the individuals that we looked at, also were given bonds over $1,000, a majority of them anyway, I think around 80%. So the bond amounts for those folks were more likely to be over $1,000 for those cases. But again, these cases also correlated with less time spent in jail than defendants with no history. So again, we're looking at folks with a history of domestic violence given bonds, often more so of over $1,000, but it didn't really have an impact on whether they stayed in jail over 3 days or not. Next slide, please.
Okay, so basically, sort of in conclusion, the majority of people that are charged with strangulation are spending 3 days or less in jail. And a lot of times it doesn't really matter what the bond amount is. So even folks that are being issued really high bonds are still equally as likely to spend more time in jail as they are to be released within 3 days. So thinking about that a little bit deeper, if the purpose of bond amount determination is to ensure public safety, it's important to recognize that victims have unique safety needs that should be considered during this process. So again, if we're thinking about a bond amount being reflective of how much risk exists to public safety and to victims, then we really need to consider victims' voices when we're trying to figure out how to move forward with cases. So we have a couple recommendations. So first of all, we recommend really incorporating victims' voices into bond hearings by utilizing the NOPD risk questions. So NOPD patrol officers ask every victim a series of questions at domestic violence incidents about potential risk. And those questions go directly on the gist and are read by judges making bond determination. And so we really encourage judges to utilize that tool to be able to really hear directly from victims in those bond hearings. I think it's important to note that, for some victims, if the defendant in the case spends more time in jail, that's going to be really helpful for them in figuring out how to ensure safety. But for other victims, that might actually be more detrimental to families. For example, if someone loses a job, which, is the family income because they're spending a longer amount of time in jail. So it's really important that we're not making sort of blanket decisions about how to handle cases, but we're using victim input to figure out how to move forward. So our next recommendation is to explore the possibility of utilizing Gwen's Law hearings. And Gwen's Law hearings are basically sort of an additional tool that prosecutors can use to request that someone gets held in jail for additional time in the absence of a bond being set. So again, the idea behind that is that for certain victims who might need additional time to plan for safety, they could request, that someone is held in jail for a longer amount of time. And again, we know that sort of regardless of what a bond amount is, that doesn't necessarily guarantee that someone's going to be held in jail. But it's really important that victims are able to communicate what their needs are to our criminal justice system in order to be served most effectively. So, you know, we want to ensure that victims are contacted as soon as possible after defendants are arrested. That's so that they're able to get assistance with planning for safety, connect to resources, and also receive information needed so that they can really have as much access as possible to the criminal justice system and participate in this process. So that is sort of our conclusion from looking at these bond cases. I'm happy to answer any questions. I think on the next slide, we just have our contact information. We're happy to sort of discuss this further at the health department. Our website is also, I added that, I forgot to put our website on there, but if you go to the city website and look up the health department, we're under domestic violence prevention. We have a lot more information about our programs on there as well for anyone who's interested.
Thank you. I'm going to make some comments on the recommendations, but first I want to give Mary Claire the opportunity to speak, and then I'll make my comments. Go ahead, Mary Claire.
Sure. I do agree with the recommendations. You know, one of the things that I have been promoting and have been advocating, especially with the new DA, is to really think seriously about how to do the Gwen's Law hearings. I think it really is incredibly important that the judges really have a sense, especially of these very high-risk cases involving strangulation. One of the things that I am working on, I was reviewing an appeal court case, and I realized that attempted strangulation with a domestic violence where it involves false imprisonment is also a misdemeanor. And so we're going to be introducing some legislation that says if a felony strangulation case is brought in addition to a false imprisonment, that be upgraded to a felony case. And again, I think the important thing to remember about these cases is that any opportunity that we can take to upgrade the case to a felony case is going to provide more protection for the victim. And you know, these are the highest risk cases. And so we have to make sure, and in that particular case where the domestic violence battery was a misdemeanor and the false imprisonment was a misdemeanor and the attempted strangulation, it ended up to being a 3-year sentence. And so while that may be fair, I still think that if we make sure if someone is held for 10 hours and is exposed to continued strangulation attempts, that definitely should be upgraded. So we're going to work on that. But the other thing I want to, that we're looking into is that a lot of these cases also involve stalking. And so this is why it's so incredibly important that we provide extra protection for the victim. We have had several cases during this COVID time where we were working with the survivor to get her into safety. And because of the needs, we had them in hotels and various types of public places. And a number of times we had our staff as well as a victim being stalked by the perpetrator. And so trying to maintain the person in jail for at least a period of time that we can do the proper safety planning with this victim and get her safe is just incredibly important. And so this is, again, why we would really support having the Gwen's Law hearing so that a case can be brought in front of the judge to really emphasize that this person may be being stalked and may be in more danger, and how important it is to give that person some amount of time that she is free from that. So, and our agencies are free from being harassed by perpetrators to be able to bring that victim to safety. So thank you, Hope and Jocelyn and Nell, for doing this report. And this is something I really pushed. And I guess the other part, you know, I know it may not
result in more jail time. It definitely sends a message to the community that if they're getting out on a $100 bond as opposed to a $3,000 bond, it may not make a difference, but it certainly sends a message to perpetrators in terms of how important or how critical the criminal justice system views these kind of cases. And we just have to send a message that this is one of the most high risk felonies that can occur and is the most likely that is going to result in a death. I just think we need to take all those issues into consideration. So that's all I have.
Thank you so much. On the Gwen's Law hearing, I absolutely agree with what you're saying. And just so everyone understands about these hearings, I know we talked about them before, but these are contradictory hearings for bail. So the way that this Gwen's Law came about was in 2014, there was a very horrible domestic violence death. And because of that, these types of contradictory hearings were at that time made to be mandatory for every domestic violence case. So there had to be a contradictory hearing for every domestic violence case. So during that, year or so, judges throughout the state of Louisiana said, you know what, this is, really too much work for us. So they went to the legislature and said, let's make these contradictory hearings permissive, meaning they didn't have to happen. There were certain conditions as to how they could be requested, either by the DA or by the judge. So once the law was changed, unfortunately, in New Orleans, we haven't had Gwen's Law hearings. That's what we learned during the budget process. In contrast, Jefferson Parish had over 1,300 Gwen's Law hearings just in 2020. That's how many the DA there requested, because at the end of the day, these Gwen's Law hearings really serve two purposes. One, it's so that there is this cooling off period from when the offender is arrested to, when this hearing takes place, so that the victim and, maybe has the opportunity so that he or she can go to a safe place, the offender can cool down. Number two, the other purpose is, of course, the risk review, the risk assessment. How dangerous is this particular offender? And that is when additional information about the history of this relationship, as Mary Claire mentioned, can be brought up. This is a bail hearing, so hearsay information is allowable and applicable. So a lot of information can actually be obtained during these contradictory hearings. And since this review process, I think, was really important because, I get it that it showed that despite the bond amounts, that most offenders were only in jail for 3 days, but because of these Gwen's Law hearings, there is now the opportunity for these offenders to be held without bond, to be held until trial, so that we ensure that the victim is safe because he or she cannot get out. And in Jefferson Parish, they hold offenders 1 to 2 a month on no bond because they pose such a great danger to the person they're in the relationship with or their family. So that's what we have been lacking. And I would ask this of the panel. In your research, did you ever see any of these offenders held on no bond? I see everybody shaking their head.
Yeah, no, I don't think so. I think we had some low amounts, but I think the lowest bond amount was $100 potentially, and that was really jarring.
Being held on no bond is that it's you cannot get out. Like we are denying bond. Is what I mean.
Got it. No, I don't think so.
And so that's my. And maybe I should have been more clear. When I meant no bond is the denial of bond.
Right. No, I understand. Yeah. Sorry about that. Yeah. No, we did not see that. Yeah.
The big point of these Gwen's Law hearings that should you find an offender that's of such high risk, that bond should just be denied completely. to protect the victim and his or her family. And like I mentioned, in Jefferson Parish, they have more than 1,300 Gwen's Law hearings last year. It's rare that they hold somebody with just denying bond completely, but it is 1 to 2 a month for extreme precautionary measures. So I just think that that's something that we should look like. And I'll just make this point again. I know that people are probably like, there's Helena again talking about domestic violence. She's been on this, for however many years now, more than a decade, really pushing on the violence issue. But the reason why I do it is because I truly believe that if we focus in on reduction of family violence and reduction of trauma in the home, we reduce trauma and violence in our community. This, at the end of the day, makes us a safer state, a safer community. We had, roughly 10% of our murders last year were domestic violence murders. If we prevent those murders, we once again work to reduce the murder rate here in the city of New Orleans. And not to mention, by preventing domestic violence, we also prevent a cycle of, someone who has lived in this household to not go down the same path. So it's really about creating a safer community and ending that cycle of violence. Why I really always focus on this domestic violence piece, because I do think it's really important. So I'll just wrap by saying that I do have a resolution that will be before the City Council on Thursday, which asks the district attorney and the judges to come up with a policy so that all the DAB strangulation cases receive a Gwen's Law hearing. I'm not saying set a certain bond amount. I'm not saying, deny bond for them. I'm just saying for these most severe cases, the strangulation cases, to please at least hold a Gwen's Law hearing to provide additional information about risk and provide additional information about the victim. So we will have that resolution and we will send it to District Attorney Jason Williams and also to Chief Magistrate Juana Lombard. I've already had preliminary conversations with them, and they are very interested in pursuing some type of policy in this direction. So we will just keep pushing and see where we go. But I just really wanted to thank all of you all for your tremendous work. And I know we have a lot more to do, but by step, we need to work to ensure that victims who are dealing with the situation end up being able to get out of them and can be safe. And at the end of the day, that we can create a much safer city and community. So thank you all.
Helena, let me just say, we are in the process of writing a improved criminal justice grant. And I am so committed to this that I am putting in a special advocate that could be responsible for the Gwen Laws hearings and make that connection with the advocate and support her and to attend those hearings. I just think this is so incredibly important that we will fund this position for the DA's office if we get funded. And I think we have a good chance of getting it funded. So we continue to be committed to this and want to provide whatever resources we can to make that happen.
That's wonderful. Thank you, Mary Claire.
Just a couple of background questions, and forgive me for not knowing, but this is truly not in my wheelhouse. Who actually makes the call as to whether or not this type of hearing takes place?
It can be done either way, either through the judge requesting it or the district attorney.
And Jefferson Parish has had 1,500 or whatever the number was. We've had none. So why is it that the folks on our side of the boundary have decided not to use this tool?
Well, the conversations that I've had, Councilmember Banks, and they've been many, is that the commissioners felt that it's really up to the DA to tell them whether or not they're going to have additional information coming from the victim. And if the DA never said that there was additional information coming from the victim, then so be it. There's no Gwen's Law hearing. So the commissioners never thought that it was really their role to call these hearings. The DA chose to never want an additional Gwen's Law hearing. And this is obviously the previous administration. They just chose not to have those additional hearings. So I can't answer why they never wanted to use this tool. I think that it is a very beneficial tool. I can't answer for the previous DA and the administration and his administration folks who work there, but that is what I have been told.
Well, if we are looking at this tool as being effective to help save lives, I would hope that the new district attorney and the new chief magistrate would be amenable to looking at utilizing this. And if it's proven to have worked in other places, it's likely to work here. So I haven't seen the resolution yet, but I'm hoping that it is very stringent in its requests that they look at doing this. We don't need to go reinvent the wheel if there's already a wheel that's rolling. And clearly the strangulation issue is one that we know is not going away until we actually take steps to make it go away. So I'd like to co-sign the resolution with you. And if we need to have either the DA and or the chief magistrate come to either this meeting or the community justice to talk to us about what is what's stopping them from doing this, then I'll be happy to do that. We need to get solutions, and we're past the point of being able to say, point fingers and talk about who's on first. We really need to get some things done, not only along with the strangulation, but along with the catch and release, and along with the juveniles and all of these other very serious issues that are affecting the quality of life for our citizens. So I'll happily join with you and look forward to trying to get a successful resolution to this. I don't see any of our other colleagues. I don't think there are any questions. I don't see anybody else. So with that, we didn't have public comment on this one, right? Okay.
No, sir, no.
So with that, ladies, thank you, and look forward to getting some progress on this. Thank you. We will move on with the agenda. This is the final presentation. Oh wait, are we doing this or are we deferring this?
This item is deferred, but there's a public comment after.
So how do we do that? Because the resolution, the legal document was deferred. So do we still have to, Paul, have the public comment, or do we not?
You don't need to read out the public comment. We can make it part of the record for when it's considered again in the future. You don't need to read it out today.
Okay. So just for the public certification, we are working on a foreclosure registry. And there was a draft ordinance done, but it had some challenges with it, and neither Councilmember Gwen nor I are interested in just passing something that is not practical and will not result in any real action. The whole idea is to get something done. We're not looking just to have a press conference to say that we did it and then it'd be of no use. So with that, we have withdrawn what was initially presented while we're working on getting something that is far tighter, that is far more practical, that we can actually get some results from. So with that, I don't have any other items. So I will entertain a motion to adjourn.
So moved.
Thank you, Madam President. I will second. All in favor say aye.
Aye.
Any opposed? All righty, folks. Thank you. Please continue. Wash your hands, social distance, wear a mask. We are far from out of this COVID. So please keep yourselves and your families safe. Do what you need to do. And if you're eligible to get the vaccine, please go and get it. Take care. Be safe.